problem in the past has been that patients with chronic wounds really didn't have much hope. We now give them an increased opportunity to get rid of problem wounds.
Wound Care Center brings together a multidisciplinary team because I, as a primary care physician, even a diabetes expert, can't do this myself. So I need podiatrists, I need vascular surgeons, I need orthopedists, and endocrinologists. We need to work together as a team for all of our patients.
When it comes to wound care, my job is really to be able to provide interventions in patients that have blockages in either their arteries or their veins, and really trying to restore flow to get wounds to heal.
Wounds are the biggest reason why a patient with diabetes may have to undergo an amputation. So if we can intervene soon enough in a wound that has the potential for progressing on in complications leading to an amputation, if we can intervene sooner, we can prevent amputation.
I had an accident, a head-on collision. I had broken hips and broken foot. What happened to my foot was, of course, they had to put pins and all in it and keep it wrapped up. And it just wasn't healing. And then I came here and they started dressing these every week and putting some medicine on them to get them to heal, and they started healing.
This is one of our advanced modalities. It is absolutely essential to any advanced wound care center. It's hyperbaric oxygen therapy.
Here we go. When they brought me in to slide me in the tube, I was like, can't do that. Then I psyched myself up, went in there, I got myself watching TV and I didn't feel like I was closed in. Then after a few more visits, I fell asleep in there.
There are some wounds and conditions that cannot be treated in any other fashion other than hyperbaric oxygen. Basically, it's having a patient in an atmosphere of 100% oxygen. This increases the oxygen blood levels up to possibly 20 times higher than it would be at sea level. You can't heal a wound unless it has oxygen, and you can't have oxygen unless you have actual blood flow to that area. And it's critical to do that in order to prevent amputations.
Is it believable what it does? It is amazing. You don't think that that's gonna do that because it's just oxygen. My wound's just like it started shrinking and shrinking and shrinking, and now it's completely closed up.
The staff is just wonderful. Everybody here is really helpful. They're friendly, and they want to get you taken care of, and it's just amazing how good they are here.
I feel like we provide care at a very personal level. It's not just managing the clinical side, but also somewhat of the personal side, as you do in day-to-day clinic work, is getting to know the patients, building a level of rapport.
I mean, they were amazing, and they're still amazing. The people out in the wound care, the nurses, even when you come in the front door, Melissa, she met her friends, she's amazing. I just think the world of all of them.